Afternoon, guys, and welcome to the podcast. Happy holidays. Today, I've got an entrepreneur coming out of Silicon Valley, Dilpreet Sahoda, founder, CEO of Trek Health. And today's talk is going to be all about healthcare startups. And we're going to be talking about healthcare tech entrepreneurship. I'm really happy to have him on and talk about his successes and his work. So, Dilpreet, welcome.
Thank you so much. Thank you for having me, Christopher.
Yeah, briefly introduce yourself, and I'm excited to dive into the questions.
Yeah, absolutely. Thank you for having me once again. I'm Dilpreet, CEO, co-founder here at Trek Health. And so for context for the audience, Trek Health is an organization that's based here in Silicon Valley and has been around for about 3 years now. And our focus really is today on helping pricing transparency data in healthcare flourish here in the US. And just as a quick backdrop for the audience, pricing transparency has been something that in the broader healthcare industry we've been talking about for quite some time. Everyone in pop culture and news is talking about how healthcare is getting extremely expensive, outpacing GDP, and it's tough for patients and providers to be able to survive in how costs are rising across the board. And so a few years ago, back in 2020, there was a ruling that was put into effect. It's called the Transparency and Coverage Act that required both hospitals and health plans across the country to publish all pricing data for the first time. And what's profound about this is that this is the first time in the history of this country that we can actually see how much hospital X got paid for surgery type X, or how much physician X got paid for an office visit. And it's really at the level of the tax ID and at the level of the service code or the billing code. And so we can, with great granularity for the first time, actually see everything across the country. This is hundreds and hundreds of terabytes of data that Trek Health has gone out, and we ingest this data, but also make it available for our clients to be able to use strategically within their organizations. And primarily today, the organizations that we serve are hospitals and provider groups that are trying to use this information to figure out how their practices or their facilities can flourish, the service areas that they can expand into, maybe how they can even better negotiate with insurance networks. But at a high level, that's Trek Health. We're a seed stage organization. As Christopher was alluding to earlier, prior to Trek Health, I've had a career in the intersection of healthcare and technology. I worked at a company called Health IQ, backed by A16Z and others. And I also worked at a company called Big Health in the digital therapeutic space, backed by SoftBank. And so super passionate about healthcare and everything that we can build in this space.
Yeah. In which one thing we'll talk about the transparency data and all of that. And then, so talk about 3 ways payers are leveraging transparency data to capture market share.
Yeah. So for payer organizations, this is an interesting point in time because as you think about an insurance network, their product in health insurance is actually the providers, right? At the end of the day, they're serving up to their membership, their patient population, and their employers that they're working with to sell their insurance packages. They're selling the idea that they have this big, broad network of providers and facilities, et cetera, to be able to actually see patients and be in network. And the challenge is often that payers typically are in a situation where they're trying to figure out the right way to price contracts, and they're trying to figure out the service areas that they can grow into. If I am a payer that has 100,000 members in Northern California, I need to make sure that I have enough psychiatry physicians. I need to make sure I have enough allergy and immunologists. I need to make sure that I have enough hospitals. I need to cover all specialty areas. And there are some guardrails legally around what's medically required on a per capita basis for insurance networks. But when you really think about strategy, this data can be used by payers to figure out how their network looks compared to other networks. They can see on a per capita basis in the Sacramento, California market or the Austin, Texas market, how many physicians of specialty X that I have versus these other competing networks. But one layer further, they can also see how much everything is priced at. And they can now use this to be able to reprice contracts and things of that nature. For payers, the upside is now the visibility gives them context into what's going on within other networks. And it gives them the ability to reprice and right price contracts wherever possible.
Yeah. Interesting. The next question I have for you is, it's more basically more transparent, and it's basically you basically democratized access to this. Where does data automation and where does AI play into your long-term competitive strategy?
Yeah, absolutely. It's a great question. I would say one thing that's important to know about healthcare, as we think about this industry, is that we're overloaded with data. When you think about an average health system, you've got your EHR systems, you've got all the incoming and outgoing claims and ERA data sets, you've got all the providers that need to be managed, and so much else. You got procurement, finance, all these functions. And actually, we're in a situation where we've got so much data generally as an industry that we don't really know what to do with it. And there's so much protection legally, which is great for security purposes, that require us to really guardrail the data. And so unfortunately, an outcome of that is also these data sit in different silos. And so for us, this one data set, this pricing data set that we think could be powerful in helping providers that are delivering high value get paid more, and helping total cost of care actually come down by navigating the patients to the right providers, we really focus on this big data set that is for the first time available. And actually, there's probably just a handful of companies in this country that are even pursuing trying to make any sense of this information. When you talk to most CFOs or most heads of industry within healthcare that have taken a look at this data, the first thing that they say is, oh, it's useless. It's just too much that the payers are putting out. I don't know what to do with it. But we generally disagree. This pricing data actually includes everything that a payer needs to publish, all service lines, all billing codes, all providers. It just comes down to how can you actually structure this data in a way that makes sense. The same is true about EHR data sets and others, by the way. When you think about why you have to first fill out a form that then gets scanned into the EHR, then gets relogged, and then when you walk into the actual room and you see your nurse and your physician, you get asked those same questions again. It's typically just an outcome of software and data and process. And so for us, that's really the journey. In this pricing data set as a starting point, we use automation and AI to do really two things. The first is to ingest this information in a way that makes sense, where, just as one example, there are about 50,000 terabytes of data that you would have to ingest just to go get data for one payer in United Healthcare and download that. It's impossible for anybody in this country to just do that on their computer and try to access information. So the first thing that we have to do from a data and sort of automation perspective is create the ETL pipeline to actually get that data and store it somewhere. And then the second component of AI comes in really at the level of making sense of this. So we've developed an AI agent that actually allows users to go in and free text ask a question. How much does the average immunologist get paid for this service in my market? Or what's the benchmark fair rate for a hospital for this particular service code or this particular DRG code? All of that stuff is something that we've been working on behind the scenes to be able to use these new LLMs and models to be able to make sense of data at scale.
Yeah. What I find interesting is that, through this, what surprising trends or inequities have emerged from the analysis of payer reimbursement data?
Yeah. I think the first is that there are massive variations in reimbursement rates, as you would expect, within singular service lines. So what I mean by that is, if a dermatologist is working in a private practice in the suburbs of Austin, Texas, they will get paid likely maybe 1/3 or 1/5 of what a dermatologist working within a health system in that region would be getting reimbursed. And this is across the board. So one common trend is that total reimbursement is typically directly correlated to total group or network size. And that's not super surprising because at the end of the day, for these payer organizations, they want to be able to go and partner with these larger systems that can just take a patient and do everything rather than sending them often to smaller facilities across the board. The other series of trends that we've found interesting is that there's generally this ability for most healthcare provider organizations, regardless of where you are in your stage of development, if you're a small private practice or a large multi-state health system, to be able to up-level. And what do I mean by that? Creating new service lines that can help decrease total cost of care and be a win for you as a provider. So one real-time example of that is ambulatory surgery centers. We have many ASCs that we work with across the country that are taking these high-cost surgeries that might be happening within a hospital setting and being billed as DRG codes and making those available in the outpatient setting on the outskirts of a health system and bringing down these total surgery costs by 3 or 4 or 5x. And ASCs are robust businesses that are doing well. Another great example is inpatient behavioral health. We often find that there's a lot of readmission for people that are dealing with chronic behavioral health conditions, and those one-off emergency visits to the ER or events that lead to hospitalization or other recurring events can be very costly over time. And so there's a real need for this to be able to be stood up We need more inpatient behavioral health across the country. And so behavioral health groups that are maybe today just doing outpatient services, but can now use this data and identify those revenue codes, those other institutional codes that they'd be able to bill if they were to go inpatient and really add more service lines to their existing practice, can sometimes be consequential in being able to help them get paid 3, 4, 5x what they're getting paid today. And so I think long-term, this will be the trend. It's not that healthcare costs will grow. It's that high value healthcare providers will get paid more. If you're able to identify a chunk of healthcare costs that you can bring down by delivering better, more focused care, I think that's where healthcare is headed.
Yeah. It's gonna be really interesting because just like you said, it's healthcare is becoming unsustainable and it's very inefficient too. So a follow-up question I have for you is because as with all startups, always have to look at what's coming at you. And so what risks on the regulatory front as well as the political front? Because obviously if you're a serious threat to the big players, they will come after you and try to shut you down, which is anti-capitalism. But what are your thoughts?
Yeah, absolutely. So for us as an organization, I will say that we exist because at the end of the day, this transparency data is now available. And that data was made available as an after effect of an executive order that was put into effect in 2020. And so now as I think about the next few years, the new CMS leadership and the new HHS leadership across the board are actually in the context of transparency, making big pushes. And so we're actually excited about the future of transparency in healthcare in this country. And I think that we're going to see more and more information getting forced to go public because at the end of the day, patients are having a hard time. The average American family today is spending $25,000 per year in their health insurance premium, while almost everyone has no idea what the word coinsurance or deductible or these things even mean. And so people are paying a lot and it's getting increasingly expensive without really even understanding what the system even does and how it all works for them. And so I think as an effect, transparency data will continue to flourish because this is one way they say sunlight is the greatest disinfectant. Bringing light and transparency to this will help entrepreneurs create efficiency and really identify those areas where great businesses can be built while actually helping the market get more efficient. And another point that I would call out is there's actually a current law that's sitting with Senate and has been passed through the House that would require PBMs, pharmacy benefit managers, for the first time to also publish all drug pricing information, which is another massive step that I think will be consequential for this country if it goes into effect. And I'm actually optimistic that it will. So in the next few years here, we'll also be able to start to democratize how people get their drugs and prescriptions, because that's another massive line item in a consumer's budget.
Yeah, really interesting. I know we have around 3-4 minutes remaining. And one thing is talking about is these tech trends. And what are the top 3 healthcare tech trends and why do they matter?
Yeah, I think the first is artificial intelligence. This is a moment at the scale of advent of the internet that we are living through today. And it's actually still the early days. It might feel like these companies are raising tens of billions of dollars and all this stuff is happening and ChatGPT has hundreds of millions of users. But actually, this is still, in my mind, day one of this new form of compute that has been created and this new form of interacting with computers that has been created. And so for healthcare organizations, what that means specifically is that we have to really be able to now develop the enterprise AI strategy for the health systems and the payers that works and actually is going to be able to take into account security and safety at its core. We've seen all of these events in 2024, Change Healthcare, the largest healthcare clearinghouse that helps process claims in this country, was down for many months because of massive data security breach. And so the current systems are not stable as they are today. But now we have this amazing new feature set that we can actually go and implement to be able to drive tons of efficiency, make provider workflows easier, make patient workflows better. And so for us to be able to do that, there's a lot of sort of work that needs to get done in the trenches to be able to make that happen. The second piece that I would call out is that I think consumers are really upset across the board in healthcare. And when we think about what's going on within the world, the CEO of United Healthcare was just shot down, unfortunately. And there's a lot of unrest that's going on. And I think that's because people do feel that there's genuinely healthcare isn't serving them for whatever reason. And everybody has their own anecdote or story of that, a denied claim, maybe some form of malpractice, something that affected them personally. And I think it's on us as an industry to go out and actually work on that. Violence should definitely not be the path that we take. And I don't support that whatsoever. But from this, I think what we can learn is people are unhappy. And the way to respond is to be able to actually help drive better consumer experience. And I think this actually ties back to AI. For technology to be able to insert itself, and people don't know what their benefits even entail. People don't know what they should be actually getting. When somebody needs to get screened for something, they have no idea that's even the case. There's no information that's safe and procured from a healthcare provider that gets to a patient on an ongoing basis outside of the clinic. And I think that's where AI can bridge the gap. And finally, I think what we're going to see in the long run is disaggregation of healthcare. I think the average healthcare provider group will get smaller rather than larger as we go into the future, which is a trend that I'm actually very excited about. I think as we think about the industry for the past 100 years, it's been this story of the clinic that existed within a community that served and was respected by the community, the doctor that was there and everybody relied on, into slowly this consolidation really by private equity and health system consolidation that I think is not going to reverse, but I think the average healthcare provider group size will actually come down, because as we think about transparency and decreasing cost of care and all of this stuff, who's that actually going to affect the most? It's going to affect these large health systems that have amazing margins and amazing businesses today. And it's going to help those new entrepreneurs that can actually create more efficient healthcare models that serve the patients and are high quality. And so I'm excited about the fact that I think actually small business in healthcare will succeed over the next decade.
Yeah. Yeah. I wrote an article on Kevin MD talking about the parasitic, just the hospital CEOs and the insurance, and benefiting the drug companies, the medical device, the FDA, the politicians, but it leaving doctors and providers and patients just basically a parasite. But really interesting work, and great. I really enjoyed keep up the great work. And we need more tech innovation. We need people that disrupt. We need more Uber, Coinbase, all these things just upgrade the system and give the system a shock. So thanks so much. Keep up the great work. And how can people find you and reach out to you and find more about Trek Health?
Yeah, no, absolutely appreciate the invite, Christopher. Yeah, you can learn more about Trek Health by visiting our website. It's trekhealth.io. That's TREK health.io. And on our website, if you're a healthcare organization, you can actually fill out a form, and for free, our team would be happy to walk you through our platform and see if we can actually uncover a use case for you to work with this data.
Yeah, awesome. And happy holidays, and thanks so much for coming on.